Hi there, my name is Hollie Grant and I am an advanced pre and postnatal fitness specialist and founder of the Bump Plan. Now in this video, I'm going to be talking to you about how to move safely with a diastasis or prolapse. Now, for some of you, you will have heard those words before, maybe because you suffer with a diastasis or a prolapse. Maybe this is the first time that you've heard of them. So really, this will be for those of you who are aware that you have a diastasis or a prolapse and you want to start thinking about how to move safely going forwards. Having a diastasis or a prolapse does not mean that you can't exercise unless you have been specifically told by your healthcare professional that you must not exercise. Eventually, once you've healed from your cesarean and you're feeling ready to get moving, you can move with a diastasis and a prolapse. You can exercise, you can be physically active, but there's some things that are really helpful to understand if you are going to do that. So really, I'm going to be talking about pressure management, which sounds really corporate, but essentially diastasis and prolapse are kind of a pressure management issue. So for us to understand pressure management, we first need to understand the core. So I have some props here. I haven't just forgotten to put them in the bin. So here I have a toilet roll insert because I really like to think of this as the core or the abdominal canister. Whatever you like to call this area of your body. So if we think about this toilet roll here, what we have is at the top, we would have our diaphragm, okay? If you've watched the video about breathwork that I did, the diaphragm sits at the top of the abdominal canister and it basically separates off the abdominal pressure, the abdominal canister, and then the air above that, the lungs and the rest of the chest cavity. At the bottom here, we would have the pelvic floor. So at the bottom of our abdominal cavity, it's not just open, otherwise everything would fall out. We've got the pelvic floor at the bottom. And then what we have wrapped around, so the tube of the core here, we've got our transverse muscle, our deep core corset muscle, the muscles of the lower back and the abdominals. So what we have here is kind of a representation of the abdominal canister. Now, inside the abdominal canister is pressure, just like we would have in a balloon. There is a certain amount of pressure inside there, and that pressure is going to change when we start exercising or being physically active. Every time we move, muscles contract, and that creates pressure in the abdominal cavity. Much like if I squeeze the balloon, I'm applying pressure to the balloon. Now, when we start exercising, we are going to be increasing that pressure in the core. And if our core was like a balloon, you can see that when I press on one part of the balloon, the pressure is kind of dispersed equally across the rest of the balloon, which is great. If we have a diastasis, which is something that happens during pregnancy, that is a perfectly normal part of pregnancy, and in 2/3 of women, roughly, it fixes itself postnatally. But a third of us will continue to have a diastasis after kind of 8 to 10 weeks postnatally. It's essentially a thinning of the tissue in between our two rectus abdominis, six-pack muscles. Now, because that tissue is thin and stretched, it can be seen as almost the path of least resistance. So when we apply pressure to the core, there is a risk that at times that pressure will push out just through that midline. So with my balloon analogy, it would almost be like there would be a really thin part of my balloon here. Maybe I've scratched it, or maybe I've kept pulling it really tight, and the balloon's thin. When I squeeze the balloon, what we would notice is rather than the pressure going everywhere, it would push through that path of least resistance. And that's not ideal. When that tissue is trying to remodel and correct itself, what we don't want to be doing is putting loads of pressure through that midline. So when you're doing some exercise and when you start moving, just be mindful of how that midline looks. And if you feel or notice lots of pressure pushing through that midline, means that the exercise is just a little bit too challenging and we need to rein it in, okay? So that's how to think about working with a diastasis. We just want to monitor, are we managing the pressure well, or is it all pushing through the midline? Prolapse is very similar. With a prolapse, it's that the pelvic floor is struggling to contain or carry the weight of your pelvic organs. So when you apply pressure to the core, so you move or you're physically active, we want to be mindful that our pelvic floor is going to be the path of least resistance if we have a prolapse. So when we're exercising, do we feel as if we're bearing down? Do we feel like we are pushing all the pressure down to the pelvic floor? Are we leaking? Do we feel our prolapse symptoms feel worse? If so, we're overdoing it and we need to scale it back a little bit. So again, thinking about our balloon, the pelvic floor is down here. It's stretched or thinned or weakened if we think about it like that. So when I apply pressure, it can be that the pressure all goes down through that pelvic floor. And so again, that means we need to scale it back. So it's about managing pressure. And I know that managing pressure can be really confusing. My clients will often say at first, I don't really get it. But essentially, what you want to get used to is thinking about when I'm moving, where am I feeling pressure? Am I feeling pressure down my midline? Am I feeling pressure down into the pelvic floor? And if that's happening, we really want the pressure to be dispersed equally. So we might just need to make the exercise a bit easier before we're able to then progress and make it harder. So I hope that makes sense. Overall, if you are working with a diastasis and a prolapse, do make sure that you're speaking really carefully with your healthcare provider, or if you're training, that you're speaking to your exercise professional and letting them know. Equally, if you come over to the bump plan, it's safe for you if you've got a diastasis and a prolapse, and you'll learn more there. But that is a potted history of how to exercise safely with a prolapse or diastasis. Hope it was helpful, and I'll see you again soon. Bye.